With the decline in donors' funding, countries must continually evaluate their readiness to own and sustain their HIV response, especially the supply chain system, and bridge any observed gaps. Hello, you're watching The Last Mile with NACA, and I'm Adesuwasi. Welcome. Nigeria has made substantive advancements in the management of and fight against HIV and AIDS through the National Agency for the Control of AIDS, NACA. However, in light of dwindling resources, which is largely from foreign donors, how ready is the country to own and sustain HIV response?
The National Agency for the Control of AIDS, NACA, has led the national multi-sectoral response to HIV through notable milestones towards a more controlled epidemic, with significant reduction in morbidity and mortality rates, as well as more people living with the disease placed on treatment in Nigeria. However, with the progress made so far, there is a paradigm shift towards country ownership and sustainability. But what does sustainability mean with regards to the HIV response?
And a simple, summary, I can say sustainability means keeping all people who have been identified HIV positive on treatment for the rest of their life. That is what we are trying, or the target we have, and wanting to achieve, because we are on the verge of controlling the epidemic. Epidemic control in HIV means you've identified virtually everyone that has HIV. They know they have HIV, and you've started them on life-saving medication. Keeping them on this life-saving medication for the rest of their life to keep the virus in them is the challenge, and is what we're looking at, how to build a structure that after the attainment of that epidemic control, there will be guarantee that this number of people, in our case, will be around 2 million people, have their medication regularly, and their viral load is also checked regularly to make sure the virus is not coming up in their blood and is becoming a risk to transmit or get transmitted to others.
Current efforts focus heavily on fiscal imperatives such as increasing domestic funding. This is important, especially with increased treatment coverage.
Funding is very critical, and if funding is not guaranteed, then sustainability may be difficult. That is one. Second, the program itself. There has to be a sustainability model. The program, as is implemented, is very expensive, especially for the government to sustain and maintain. Three, commitment. And this commitment is across stakeholders. The federal government is one of the stakeholders. The states are a key and critical stakeholder. If we get the state on board, and what we require from the state is something that we believe the state can do, to keep the clinics running and to provide money for coordination, program coordination within the state, which is done by the staff that belong to the state. So if we get that right, and we get some good help still from our donor partners, we're very confident that after we attain epidemic control, we will also navigate sustainability of the control.
In light of donor fatigue, what is Nigeria doing to ensure sustainability?
The money from the international donors has not reduced yet, but we know that that's where we are headed. the money will eventually reduce. So before we reach that bridge, what we are planning is to make sure we put structures in place. And this is where the HIV Trust Fund of Nigeria comes into play, which is going to be managed solely by private sector. And the goal is to help contribute materials or contribute medication, commodities, reagents, test kits for prevention and elimination of mother-to-child transmission of HIV. But if we get that sector supported by private sector, then we can look at the two other key areas which are very important, the general population and also the key affected population, to make sure that our programs to these two broad groups, is not in any way affected. So this really very important. And if we're talking of sustainability, we're talking it with these activities in mind.
The agency is addressing financial and human resource gaps through innovative resource mobilization and effective workshop planning.
Going forward to sustain the program, we can't continue to do business as usual. It has to be innovative and it has to be cost efficient. An example is in the years past, we procure or we source our medication and kits by our local vendors. But we realized there are cheaper ways to do that. So we've gotten waiver and we're accessing directly from manufacturers, directly from platforms that provide them at a very cheap rate. And we're happy money that ordinarily will help us cover 50,000 people is now helping us to cover 100,000. So we are also looking at the way we deliver these programs, the way we deliver the services. We're no longer staying in facilities as we've done in the previous years. We are moving into communities, into households to provide services, to meet a recipient of these services halfway. Some of them are finding it very difficult, to come to clinics, or hospitals, or primary healthcare centers to access services simply because of stigma and discrimination, and to some extent because of cultural beliefs.
Addressing sustainability requires a broader framework beyond funding stability. For example, certain interventions such as programming for key population.
The programming for key population is something that I think as a country we have done very well. A couple of years ago, we had only 10 places, or less than 10 places, where key affected population go to access services. But as I'm talking to you now, we have over 100 places, and these numbers are increasing. Why? Because key affected population are the major drivers of HIV epidemic. They are at greatest risk of giving out HIV to people, and they are also at the greatest risk of receiving because of behavior. So this population are very vital to controlling HIV. And we're doing everything to have access to the population via their network, and to make sure that they are aware of the risks associated with their lifestyle and behavior, and also the services that are available. And I'm happy we're making tremendous progress in that area.
Nigeria has made some progress towards achieving country ownership and sustainability, especially with President Muhammadu Buhari's commitment to increase domestic resourcing of HIV response. However, it is important to secure the political buy-in of the states while resource mobilization from all sectors should be prioritized.
Hello?
Hello, babe. What's up? How this Valentine will be now? You know I love you.
Love don't be for mouth. Now by action.
You have to show it. First to yourself and then to others. So show love this Valentine's season by getting tested.
Know your HIV status. It is free in every government hospital. I beg, make una try whole body. But if you no fit, practice safe sex. Protect yourself and others.
And finally, love is the best treatment to heal the pain and stigma of people living with HIV.
Helping us achieve a country free of HIV is the greatest show of love to our fellow Nigerians. Spread love, not HIV. Happy Valentine's Day.
UNICEF presents that globally, at least 300,000 children were newly infected with HIV in 2020. Now, of this alarming figure, Nigeria was responsible for 20,695 cases. This indicates a need for a much more strategic approach to prevent further decline in the nation's HIV infection rate.
About 300,000 children born HIV positive. Over 20,000 of them were born in Nigeria. This is a crisis of immense proportions, and it can potentially erode all the good work we've done over the last 2 decades.
The taps in the general population and key affected population are now running slowly. However, that of mother-to-child transmission is the one that is still running fast. And this means this year, 2022, we're going to look at expanding our services to include every pregnant woman and get them tested and make sure that every HIV positive pregnancy is prevented from transmitting that disease to the newborn.
The HIV Trust Fund is timely and will be critical in helping us address the gaps in acquiring test kits, laboratory reagents, and drugs for pregnant women over the next 5 years. We are excited about the private sector commitment to this cause and wish to thank them in advance for their engagement.
The update segment brings you highlights of NACA's activities across the country and elsewhere. Keep watching.
The National Agency for the Control of AIDS, NACA, recently organized a consultative meeting with heads of the State Agency for the Control of AIDS, SACA, on sustainability of the HIV epidemic control. Present at the event were the Director General, NACA, Dr. Gambo Aliyu, directors and heads of the NACA zonal offices. Welcoming the SACA delegates, the Director General, NACA, stated that the meeting provides a platform to share experiences and proffer solutions together.
We are all welcome here, and I'm very interested in listening to these issues, or concerns that the SACAs have, and now if you go out solutions together, because as you operate at state level, you know where the shoes are pinching the most. Just the same way as I operate here, I know where the shoes are pinching the most. I know where I run to, to get things done, and I know how to begin to prepare for things ahead when I know that by the time I will be needing that support may probably not be guaranteed. So the same as you operate in the state. So it will be interesting to listen. It will be interesting also to share ideas. It will be interesting also to put heads together to provide solutions.
Dr. Aliyu also urged the state to make good their commitment to the national response.
Please advise your state governors they shouldn't joke with the counterpart funding, where Global Fund provide 85% of the money and the state is supposed to provide 15% for activities involving HIV, TB, and malaria. The state should endeavor to do that. And this money, 15% the state is providing, is not required to come to the Global Fund or to come to the PR that is implemented, in this case NACA, if it's HIV, no. The 15% is meant to be spent, and we only have evidence that yes, that 15% is spent by the state. That's it. That's all that is required. 15% of the counterpart funding is expended by the state on the program in the state.
Some of the SACA chief executives raised concerns on some issues both peculiar and similar to their states and also made recommendations. Deliberations at the meeting was fruitful as the DG and various directors of NACA duly responded to the concerns raised by the SACA heads.
They go like this now. Take am easy now.
Now hospital I dey go to do HIV test.
Now everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Now make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labor, or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sen ten ce. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
To tackle poverty and social inequality, which are drivers of the HIV epidemic, the National Agency for the Control of AIDS, NACA, carried out several capacity-building and empowerment programs for vulnerable and key populations across the country. Most recent was the HIV Sensitization and Empowerment Workshop in conjunction with Senator Oladipo Odujiri in Oderemo, in the Remo North local government area of Ogun State. Present at the event were NACA officials, including the Acting Director, Special Duties, Alhaji Baidi Gajo, and the Deputy Director, Community Prevention, Care and Support Services, Dr. Yinka Anuemwa, some government functionaries and critical stakeholders in the state. The facilitator of the program and chairman of NACA Governing Board, Senator Oladipo Odujiri, said the empowerment program aims to strengthen self-efficacy and decision-making power of vulnerable groups and key populations in the community. In her remarks, the State Commissioner for Health, Dr. Tommy Coker, commended NACA for the initiative, stating that it is in tandem with the state government's agenda. The training, which covered tailoring, soap and cosmetics making, catering, makeup, hairdressing and cutting aims to empower 150 youths and women, after which certificates and startup funds are given to the participants. Some of the beneficiaries thanked NACA for the program, stating it would go a long way to enhance their quality of life moving forward.
I don't know there is a platform like this, so I was so happy to be part of this empowerment. And since yesterday, it has been an interactive class, and it is actually an educative one.
I'm learning barbing, and at least after the program, I'll be able to establish myself. And at least in the community, it will be a very, very easy one, and it will be of help to every one of us in the community.
It will help us to sustain ourselves and our family. You know, when one is empowered with work, with skills, that one will make it to go a long way, to become a better person in the society. And that's why I'm saying a very big kudos to those that are organizing this training. I'm so grateful and so happy. Thank you and God bless you.
NACA has so far empowered about 12,000 individuals across the country, even with limited resources, further reinforcing its unwavering commitment to achieving HIV epidemic control before 2030.
Hello?
Hello, babe. What's up? How this Valentine will be now? You know I love you.
Love no be for mouth. Now by action.
You have to show it. First to yourself and then to others. So show love this Valentine's season by getting tested.
Know your HIV status. It is free in every government hospital. I beg, make una try whole body. But if you no fit, practice safe sex. Protect yourself and others.
And finally, love is the best treatment to heal the pain and stigma of people living with HIV.
Helping us achieve a country free of HIV is the greatest show of love to our fellow Nigerians. Spread love, not HIV. Happy Valentine's Day. A major challenge facing HIV control in Nigeria is the growing number of people living with the virus but are yet to learn about their HIV status due to fear of stigma and discrimination. HIV self-test kit is a simple, effective, and quicker way of learning about your HIV status in the privacy of your home. The test can be performed using saliva by rubbing the outer part of your upper gum, followed by the outer part of your lower gum with a flat pad, and then dipping the flat pad into a buffer tube to wait for 20 minutes for the result to read. For more information, contact our call center at 6222 or NACA's website. Our services are available to you Monday to Friday every week.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Adesu Alsi. Goodbye.